Thank you so much for jumping on tonight. I'm pretty excited to get to spend the next hour with you guys talking about something that is probably my favorite topic, the low back. Hopefully through the course of this next hour, we'll be able to give you guys some insight onto low back pain, some strategies for managing it and preventing it, and hopefully you'll learn something by the end of tonight. So our objectives for this evening, introduction, why the back and why are we talking so much about the back? And I'll give you a hint, it has to do with the prevalence of low back pain. We'll talk a little bit about basic anatomy just to help you understand what might be going on with the spine and potential sources of back pain. So we'll talk about some of the most common musculoskeletal causes of low back pain. We'll get into some prevention strategies, ways to avoid low back pain and injury. And then what are some strategies for managing low back pain when you already have it? And then finally, we'll get into questions. So, hopefully these next little bit of time, you'll learn some really awesome stuff. So why the back? Why do we spend so much time talking about the back? Part of it's because we have only one. It's when you injure a shoulder, you can stop using your right arm and just kind of bear the brunt of things with your left side. But the back, we don't have that luxury. We have one spine and it's hard to get off of it, so to speak, when you have pain. So we don't have the same ability to kind of take it easy on our back the same way we do when we injure some of our other body parts. Back pain affects over 600 million people annually in the US alone. So it's incredibly prevalent. There are some studies out there that suggest that up to 80% of the population is going to experience low back pain at some point in their lifetime. So chances are, if you're on this call, you have probably had low back pain or you will. And if you have not, you should probably play the lottery because the odds are much in your favor if you have not had some. And it's one of the top reasons that people see their primary care physicians is for low back pain. There is a tremendous amount of money spent towards treating low back pain, between medical care, being out of work, just all that stuff puts a big strain on the healthcare system as well. So this is why we're talking about the low back so much and why we're talking about it tonight too. So I wanted to get into some really basic anatomy. This is not to make you guys anatomical professionals when it comes to the low back, but just to give you some insight and some ideas of what's where and what's going on with the low back. So this view right here is a side view of the low back. Okay. Up at the top, you've got your lumbar vertebrae, and down here, down in this area down here, you have your sacrum and your coccyx or your tailbone. You have 5 lumbar vertebrae. You don't see all of them here. This is a segment. Back here, these bumps that stick out of the back of your spine, those are your spinous processes. And if you've ever felt along the back of your spine and you feel the bumps, those are your spinous processes that you're feeling. Okay. And on the front of those, the front of your spine is your vertebrae, your vertebral body. And down in the middle, between where your spinous process sits and between where that vertebrae is, you have a column, and that's where your spinal cord runs. Although your spinal cord kind of ends at the top of your low back, but you still have nerves that come down below that. In between each segment of your spine, you have a hole. That's your intervertebral foramen. That's the hole where your spinal nerve comes out. Those nerves are nerves that come off of your spinal cord, and they supply your legs, your lower extremities. It's your sensory input, so your hot, your cold, your pain, your numbness, your tingling, as well as your motor input. So the ability of the muscles in your legs to work and to function. It sends all the signals to your lower extremities. So all those spinal nerves that come out through those little tiny holes supply your legs. in between the segments of your spine, those pinkish kind of reddish blocks on the picture here are your intervertebral discs. And they act as a cushion, a spacer, and allow for movement within the lumbar spine. And we're going to talk a little bit more about disc issues later on. But so this is just a brief anatomy of the basic anatomy of the low back so that you can have a better understanding of what's going on at the low back. All right. This picture can be incredibly overwhelming. I did not put it on here to think, oh my goodness, you should know about all these muscles that act on the low back, but really just as to help you gain an appreciation for how many muscles impact the low back. You know, on the left-hand side, you've got what are called the superficial muscles. So the closer to the surface muscles in your low back. Some of those you may be familiar with. You've got your latissimus dorsi, so those are your lats. Your gluteus maximus, you can see on there, your glutes. And then as you get a little bit deeper, you have things like your erector spinae muscles. Those are the muscles that do exactly what they say. They keep your spine nice and erect. They help you to stay nice and upright. And then towards the right-hand side, you've got some of the deeper muscles in your low back. And again, really just want you to appreciate just how many muscles work on the low back. And I want you to remember this picture when we talk about core stabilization later on, because core stabilization is utilizing these muscles, okay? It's not just the abdominals, which do impact the spine, but there are so many more muscles that impact the spine. In addition to all the muscles you see on here, you also have your hip muscles that impact the spine. A lot of them attach near the spine or on the spine. And so in addition to all these back muscles, you've got your hip muscles that also play a role in your low back. So what are some of the most common sources of low back pain? There are a tremendous number of places that low back pain can come from. You know, you have organs that can refer pain to your low back. There's all sorts of things, but we're going to talk about some of the more common musculoskeletal causes of low back pain, the things that, you know, we can do something about as therapists and things that you can do to prevent back injury, musculoskeletal injuries. So we have muscular causes of low back pain. So you have things like sprains and strains, and these tend to be a little bit more of the acute low back pains. So acute meaning more recent onset, not an old injury, but some inflammation, you've strained your muscle, you've sprained your muscle. There are also weaknesses and imbalances of muscles. So when all of those tons of low back muscles that I showed you on the previous slide aren't all working together the right way, and you have an imbalance of those muscles, they can contribute to more chronic or long-term low back pain. Okay. It's also important to keep the hips and the lower extremities strong, since they also act on the low back. And then other sources of back pain that we're going to talk about are the lumbar discs, which pain can come from discs themselves, as well as nerve compression. And then you've got arthritis or degenerative disc disease or degenerative joint disease. Any of these might be familiar terms to you. It all basically means some narrowing of the spaces in the spine or spinal stenosis. All right, so lumbar discs. Pain can come from the discs themselves. So the discs that sit between your vertebral bodies, it's white on the picture currently up on the slide. The discs themselves have a nerve supply. So when you injure a disc, some of the pain that you feel or someone may feel can actually be just pain from the disc itself. But you can also have various degrees of disc bulges or herniations. And when you have those, that disc material moves back into the space where those nerves are sitting, and it gives those nerves less space. And then you'll get some compression of those spinal nerves. And a lot of times we call this or refer to this as sciatica. That's a really common term for the symptoms of pain, numbness, tingling, weakness down the leg is sciatica. There are a bunch of different stages to a disc herniation. And I wanted to share this because not all disc herniations are the same. They don't all mean the same thing, but we use that term very loosely and interchangeably. So disc herniations, you have in these pictures here, the pink portion of all these pictures is the center of your disc. Okay, it's kind of looking from the top down at your disc. And that center of the disc is your nucleus. And it moves around. It's supposed to move around. It's got a liquid component, it's fluid, it's hydrated. And around the outside is the yellow part there is what's called your annulus. Think of that as like a barricade. It keeps that disc contained. Okay. So here you have the first picture, you've got a normal disc, the barricade looks nice and uniform. The disc is sitting beautifully in the middle there. What happens is over time, because of life, the way that we, our postures and things like that, sometimes we start to put external pressures or extra pressures on that disc material, that nucleus, that center pink portion, that then causes it to push against that annulus, that barricade. So things like lots of sitting, lots of forward bending, lots of lifting, it causes that pressure to push against that external barricade. And so what happens is it wears down over time. So the next picture, next to the normal disc, you have the degeneration of a disc. And that's where you start to get a weakening of that barricade. That disc is just starting to push out just a little bit. All right. The next picture, the bottom left picture, is a prolapse. That's where you start to have just significantly less intact barricade. All right. And that disc material is just making its way a little further out, but it's still intact. It's still contained. Then you've got extrusion. The disc has busted through, it's gotten free, and it is just pushing its way out. And you've broken down those outer fibers of that annulus, so that barricade has been broken through. And then you have a sequestration where that disc material really pushes its way out. Why does any of this matter? Because again, not all disc herniations are the same. Everyone that has a disc herniation can be anywhere on this spectrum. When you have a degenerative disc, it tends to be mostly back pain. And these are not hard and fast rules. These are, generalized statements. But for the most part, degenerative discs cause mostly low back pain. When you have a prolapse or an extrusion, that's when you start having back pain and leg pain. And sometimes it moves around. It can be intermittent. It can move from, sometimes it's in the thigh, sometimes it's in the back, sometimes it's in the calf. And it's normal. That's part of just depending on how irritated that disc is making that nerve at any given moment will dictate kind of where things are felt. And then you have the sequestration, which consists of mostly leg pain, and in a lot of instances tends to be pretty constant leg pain. Okay. So since everybody has either had a herniated disc or knows somebody who's had a herniated disc, and everybody has, the opportunity to research and Google, there's a lot of really good information out there. And there's a lot of really bad information out there. So I want to spend a little time clearing up some myths and facts on herniated discs. So we're going to play a little game of Mythbusters and see how much you know about herniated discs. And, feel free to kind of think about it in your brain. I'll give you guys a few seconds. Just think about it. Think about what your answer would be, and then we'll either confirm or dispel the information. So, fact or myth? Having a herniated disc most likely means you will need surgery. Think about it for a minute. That is a myth. So 90% of people with a herniated disc do not require surgery. Surgery for herniated discs is usually reserved for severe, constant lower extremity symptoms. So that pain, numbness, tingling, burning, constant, doesn't ever change, doesn't ever go away. Loss of motor function. That is the loss of the ability of your muscles in your legs to work. You guys may have heard of something called like drop foot, where the muscles in the foot and the ankle stop working. That's an example of loss of motor function. It's not limited to the foot and ankle, but that when you can't pick up that foot, when you can't move that leg, when you can't walk right, when you become at a higher risk for falling because your legs aren't functioning the way you need to work, those are more indicative of potential surgical candidates. And then finally, the loss of bowel and bladder function. So if you lose your bowel and bladder function, it's usually a more significant compression of the lower end of the spinal cord, and that's usually almost always a surgical intervention. But 90% of people with a herniated disc do not need surgery. So the odds are in your favor. You get a herniated disc, it's not the end. Most people are gonna do okay. All right, next one. Fact or myth? There are a lot of people walking around with a herniated disc and they have no idea that they're walking around with a herniated disc. What do you think? You think it's possible to be walking around with a herniated disc and have no idea? That is a fact. So 30 to 40% of people over the age of 40 that have absolutely no symptoms, no back pain, no leg pain, no numbness, no tingling, no loss of motor control, 30 to 40% of those people over the age of 40 have a herniated disc on an MRI. So why does that matter? It matters because you can have a herniated disc and not have pain. You can have a herniated disc and not have symptoms, okay? Final one on my fact or myths here. Having a herniated disc means you need to stop exercising until it gets better. You know, should you stop doing your exercises until things get better with your herniated disc? That is a myth. There are a lot of ways to safely exercise with a herniated disc. It just depends on the individual. Okay, everybody's a little bit different. So usually, not always the case, but usually individuals with herniated discs are going to have a harder time with sitting, bending forward, driving, getting up after they've been sitting for a long time. And by harder time, I mean symptoms that will travel further down the leg symptoms that become more intense, or they get really, really stiff, especially when they get up after sitting for a long time. So usually these individuals will do better with walking and bending backwards. Those tend to be the exercises that benefit people with a herniated disc. Now, not exercising and not doing anything is probably going to have the opposite effect. You have a herniated disc, most likely sitting around is going to make it worse. So you want to get up, you want to move. Walking is typically good. I will say walking uphill or on an incline will make it worse most of the time, because when we walk on a hill or an incline, we tend to walk a little bit more bent forward. And that will tend to exacerbate symptoms or make them worse. But the moral of the story is that most people with a herniated disc don't need surgery. You can have a herniated disc and not have any symptoms, so they can get better. Okay, your symptoms can improve. And there are exercises that you can do with a herniated disc that will help you to get better. You don't have to stop exercising, you just have to do the right thing. All right, so now that we've cleared up some myths and hopefully cleared up some myths on our herniated discs. We'll talk a little bit about spinal stenosis, degenerative joint disease, degenerative disc disease. A lot of times these get used interchangeably. This is a general term for narrowing of the foramen, which is the spaces around the nerve. So if you can see in the first picture with the yellow arrow, it's pointing at the intervertebral foramen. That's the hole where that spinal nerve comes out that we showed you in the early on anatomy slides. The discs in between your vertebrae, those vertebral bodies. So in this picture, it's that blue disc in between right in here. Over time and with age and with life, those discs dry up. Okay, so degenerative disc disease is a really fancy way for normal aging. All right, so as they dry up, the space where that nerve comes out gets smaller. That height collapses, the space gets smaller, it can compress those nerves. It typically happens in the older population over the age of 65. Usually these individuals are going to have a much harder time walking unless they're leaning on something. So these are the kind of people, these are the kind of symptoms consistent with you can't walk around your living room, but you go to the grocery store and you can walk if you have a shopping cart and you're leaning forward. The symptoms go away pretty quickly with sitting, usually less leg symptoms with sitting. And exercise is still appropriate for these individuals. Most of the time, again, no hard and fast rules, there are always exceptions, but most of the time, individuals with true spinal stenosis will feel better if they ride a bike. They might be able to take a walk on an incline, uphill, put the treadmill up on an incline, or walk in the grocery store with a shopping cart. It's also really important to keep the hips strong and flexible when you have spinal stenosis, because the stronger and more flexible that the hips are, the less you rely on the low back during walking. So you can get more extension or that backwards bend from your hips instead of your low back. And that will make walking a lot easier. So a lot of, forward bending, riding a bike, and keeping the hips strong and flexible can be really beneficial for spinal stenosis. So you don't have back pain. That's great news. How do you keep your healthy back healthy? First thing is exercise. We are meant to move. That's why our bodies have all these fantastic moving parts. We are not meant to sit around. We are not meant to be stagnant creatures. We're meant to move. So keep your body moving. If you are a smoker, smoking will cause discs to degenerate much quicker. And if you do have an injury, it will impair your healing time significantly. So quitting smoking is tremendously beneficial for spinal health. Also, we can focus on active sitting. What is active sitting? Well, these first two pictures are not active sitting. And I suspect there may be some of you out there that kind of look like those first two pictures right now. It's, late on a Tuesday night after a long day. We might all be a little slumpy. But if we can avoid getting into these bad postures when we sit and focus much more on this guy with the happy face all the way to the right, nice and upright, he is engaging his core muscles in that picture. That's what we should be doing. We should be actively sitting, not passively sitting and slumping. It reduces stress through a lot of the structures in our low back. It keeps our core muscles firing. In addition to that, we're not meant to sit for long periods of time. We weren't designed that way. So getting up and moving frequently, especially if you spend a lot of time working on a computer, is so important to keeping your back healthy. I tell people all the time, set a timer, 30, 45 minutes, get up and just take a little walk around. So that active sitting upright, but also getting up and moving frequently is so important in keeping your back healthy and avoiding injury to your low back. You can also keep your legs strong. Your legs support your spine. When your legs are strong, you rely less on your back to do things like picking things up, picking up that box, picking up the kids, getting into and out of chairs. When you have strong legs and hips, you can utilize those muscles and not strain your back. So keeping your legs strong is really important. Also, maintaining a strong core. Guys, maintaining a strong core, and core exercise is not doing sit-ups. Abdominal crunches are fantastic for appearance purposes, but they're not super functional, and it does not engage the muscles in the core the same way as other exercises. So unless your lifestyle consists of you like laying down and sitting up repeatedly all day long, it's probably not the best and most functional way to strengthen your core. But there are a lot of really easy, simple ways that you can focus on your core. So how do you work your core? I mean, you could try some of these guys. I'm not sure I could do any of these. Actually, I'm certain I cannot. But these are not necessary, nor are they realistic. But what is realistic? Start with some abdominal bracing. Abdominal bracing is when you tighten your tummy muscles. You're not holding your breath. You're not sucking your stomach in. You're tightening your tummy muscles. That forces all of your stabilizing muscles to start to engage. I always start with abdominal bracing and just teaching those muscles to fire. So tighten those tummy muscles. If you're not able to talk while you're doing it, you are holding the wrong thing. Don't turn blue. Don't hold your breath. Tighten your tummy muscles, okay? This then becomes the basis for making anything into a core exercise. If you do abdominal bracing, anything in your world can pretty much become a core exercise. So some ideas are, if you want to practice squatting to a chair, all right, tighten your abdominal muscles, focus on maintaining a nice inward curve at your low back, bend at your hips, not at your low back. And now you're working your leg strength, you're engaging your core, and you're doing something functional. Everyone has to get into and out of chairs. Everyone has to get onto and off a toilet seat. It's great functional exercise. Lifting light weights while you're doing an abdominal brace. Tighten those abdominal muscles and pick up a light weight. It teaches those core muscles to work while you're doing other things that are functional. Everyone has to put something in the fridge or get something out of the cabinet or pick something up off the ground. So teaching those muscles to work while you're doing other things is so important. You can do a step up onto a step while you're tightening your abdominal muscles. Works your leg strength, teaches those core muscles to fire, and it's functional. People have to go up and down stairs. People have to go up and down curbs. And then another one that I really like is this hip three-way kick with an abdominal brace. You stand nice and tall, hold on to, a countertop, a chair, a couch, whatever you need to maintain your balance, but nice and tall. And you brace your abdominals, you bring your leg forward a little bit and then come back. Brace your abdominals, bring your leg out to the side and come back. Brace your abdominals and kick to the back and bring it back. Do it with nice upright posture, and it teaches your abs to fire while you're moving your legs. Functional, because that's how we walk, all right? It doesn't have to be complicated to be effective. So we don't have to do anything fancy to get our core to kick in. We do things with an abdominal brace and with good posture, and just about anything can become a core exercise. So what do you do when you already have pain? Well, the first thing to remember is that not all back pain is created equal, okay? When you have back pain, everybody has suggestions. Aunt Sally recommends the $872 pillow that will help you sleep through the night. Your neighbor Fred insists that if you sleep upside down hanging by your toes for 3 days, you'll feel better. Your cousin Jill tells you that if you lay on your stomach, you'll never be the same again. It's different for everyone. Not everyone's back is the same. Some people need to focus on extension-based exercises. So what that means is people with a herniated disc, that have issues with sitting and bending forward and driving may need to do some backwards bending exercises and walking. People that tend to have spinal stenosis or the narrowing of that vertebrae, people that have the problems with walking upright and they're better when they're sitting, they may need flexion-based exercises, okay? Or they may need to work on their hip mobility and their hip strength. Almost everybody, I can't really think of anybody who would not benefit from core strengthening. Something as simple as abdominal bracing can benefit everybody. Most people will benefit from restoring normal functional movement patterns. What does that mean? That means teaching your body to move and do things the way that they should do them so that you don't place unnecessary stresses on the back. So retraining those movement patterns that you've gotten out of the habit of doing, instead of standing up and bending forward every time you stand up, you teach yourself to hinge at your hips and stand up, okay? Most people do not need a back brace. There are a couple of exceptions. That's typically people that are lifting very, very heavy while they're working through back issues or back injuries. But what happens is when you put a back brace on, we spend all this time trying to retrain our core muscles to stabilize us. And then you put a back brace on and you have external forces that are now doing that for you. Your body is not going to learn how to do it. So back braces are rarely a good idea. And these are just some examples. First picture is an example of someone doing an exercise if they need extension. So maybe that herniated disc. Second picture is, flexion-based exercises. So maybe that's spinal stenosis. Bottom are just a couple of more advanced core and or pelvic and hip stabilizing exercises. So if you have sudden, severe, constant pain, or you're beginning a new exercise for routine for the first time, you should see your physician to just make sure you're good to start exercising. But some basic guidelines: keep moving. Rest can be very, very detrimental. Complete rest rarely helps any of the back pain. Don't push through pain. You find movements that work for you, and what works for one person doesn't always work for someone else. So you have to listen to your symptoms and not push through pain and do what works for you. And then see your local PT to help guide you when you're in pain and can help move you in the right direction. All right, so when should you see a PT? Well, when you can't or don't want to figure out the movements that are best for you. If you can't figure out, which movements are the ones that are best for you, or you don't feel comfortable making that decision, come see a PT. That's what we're here for. When your back pain interferes with what you need to do in life, come see a PT. When you can't go to your kids or your grandkids' games, when you can't pick the things up that you need to pick up for work, when you can't go for those walks that you enjoy going for, come see a PT. When you want to learn how to avoid injuring or re-injuring your back, come see a therapist. We have so many tidbits and pieces of information that can help you in terms of avoiding injury and re-injury and how to keep your back healthy. So you do go to a PT. What can we do for you? So assess for and guide you as to which types of movements are best for you and your back issue. Therapists can also retrain your functional movement patterns to keep you from getting re-injured. So teaching you how to do things in ways that reduce the stresses through your back, how to pick things up, how to get up from sitting, how to get back to working out at the gym. How do we do all these things without re-injuring you? We can guide you. We're movement specialists. This is what we do. We can also help to determine when you might need further intervention. When exercise and therapy is not the answer, A lot of times we can say, you know, most people, 90% of people with herniated discs and a lot of other people with low back pain in general get better with exercise and with therapy, but we can help you determine when you need to seek other intervention. And then finally, we can help you to modify activities so that you can still do life and the things that you like to do in some capacity through your recovery process.